Okay, we will move in this 8th section in the polytrauma station of pathology in the MRCS Part B. And this station will be about hypersensitivity, hypersensitivity reactions, okay? And you want to know that the jumping to this pathological topic and the questions about it will be sudden. So it is not related to most of the things that are mentioned before, but it will be definitely related to something in the scenario, because they told you that patient received a blood transfusion, and one of the complications of blood transfusion is a hypersensitivity reaction that we are going to mention in this in this part here. Okay, so first of all, they will ask you what is hypersensitivity reaction, and this is a definition. Okay, so the definition of hypersensitivity reaction, it is an exaggerated, and let me tell you that this is the key word here. It's an exaggerated response, or it is an exaggerated response. Let us make it easier here. Okay, by the immune system, okay, to a certain or a particular stimulus. Okay, so this is the definition in simple words. It's an exaggerated response, and the most important point here, because the immune system has a response all the time, but it's an exaggerated response of the immune system to a certain or a particular stimulus. This is the first part. So the second part will be how many types of hypersensitivity reactions do you know? And there are 5 types. Okay, there are 5 types of hypersensitivity reactions. Fine. So we will start one by one, and we will try to make it easy and short for you. So type 1, this is the hypersensitivity reaction. Type 1 is immediate, and this is the main characteristic for it. This is the main feature. It's immediate, and this occurs due to mast cell degranulation, mast cells degranulation. Okay, granulation. And the third important information about this type 1, it is mediated by immunoglobulin A. Okay, so these are the most important features. It's immediate. It occurs, the signs and symptoms occur immediately when the immune system is exposed, or the person is exposed to the stimulus. Okay, and it occurs, this is the mechanism. The mast cells degranulate and lead to this reaction, and this degranulation is mediated by immunoglobulin E. Actually, for all the types of hypersensitivity, you want to know the main feature, you want to know the mechanism by which it occurs, and you want to know some examples. In this case here, in type 1, asthma, bronchial asthma is one type, anaphylaxis is another example for hypersensitivity type 1, and also atopy if you want. Okay, so this is the first type. The second type of hypersensitivity reactions, this is usually related to transfusion. Okay, and it is an antigen antibody reaction. This is the main thing, and remember that your main example here will be transfusion reaction, the type 2. Okay, and to remember it is type 2, and it is related mainly to transfusion reactions. So T and T, both of them will be easy for you to remember. Okay, so the mechanism, it is an antigen antibody reaction. There is an antibody that attacks the antigens on the surface of the blood cells, And in this case here, in the transfusion reactions, these are the ABO antigens, as you know. Okay, so autoimmune hemolytic anemia also is another example for you. Okay, this is type 2. And now we will go to hypersensitivity reaction type 3. And in type 3, actually, this is it's an antigen antibody complexes. In the previous one, it is an antigen antibody reaction. Here it is an antigen antibody complexes that form and lead to the reaction and disease. Okay, and the most important example here for you is the SLE. Okay, so this is type 3. We are going now to type 4. Okay, hypersensitive reaction type 4. And the main feature of this one is that it's a delayed reaction. Okay, this is a delayed reaction, and it is mediated by T lymphocytes. This is the $1 million information here. I hope that I wrote it right. The lymphocytes, okay. Okay, lymphocytes. It is mediated by T lymphocytes, and contact dermatitis is the main example. That one doctor wears gloves that contain the powder, and after 48 to 72 hours, this lady or this gentleman doctor develops itching and blackish discoloration and some rash and so on. So it is delayed because the signs and symptoms develop after a while, after hours or sometimes after days. Okay, well, we will go now to the last type of hypersensitivity reaction, and the last type here is slightly different actually, and needs some sort of understanding. So there are antibodies included here, and those antibodies are O2 antibodies. Okay, so the main feature of these O2 antibodies is that it is mainly stimulatory. Okay, so they will exaggerate the action of a certain organ, and an example for this is Graves' disease. Okay, and in Graves' disease there are O2 antibodies. Okay, O2 antibodies that attack the thyroid gland, and they lead to the production of the thyroxine in huge quantities, and they lead to the signs and symptoms of Graves' disease. Okay, Myasthenia gravis also could be another example. So these are the 5 types of hypersensitivity reaction with a definition in this way. You can do well in the exam if you answer in this way.